And greetings to all of you who are with us again on Doctors Go Live on Facebook. It's a very pleasant afternoon today. We will be talking about hemorrhoids, and with us today we have a consultant general surgeon from Columbia Asia Hospital Seremban, Dr. K. Yugasaravanan. Okay, doctor, hi, how are you today?
Hi, Sakina. Good afternoon. I'm fine.
Good afternoon to you. Okay, as we all know, piles or hemorrhoids is one of the most common disease in humans. Patients suffer in silence due to embarrassment, hence they delay their visit to the doctor. I'm sure you have had this experience before, where patients will come to you late, okay, making the problem more complex, I assume. But okay, let's get to the details of this situation. Perhaps we can start off by explaining what exactly is hemorrhoid.
Okay. Yeah. Good afternoon to all our audience today. So hemorrhoids are vascular cushions in the anorectal area. These are actually this hemorrhoidal tissue are actually present in all of us. Actually, it has a very important function in the continent mechanism. Whenever we pass motion and things like that, most of us are asymptomatic. However, today's topic is for those who are actually having symptomatic hemorrhoidal disease.
Yeah.
Next.
Doctor, you mean to say that sometimes people get hemorrhoids without symptoms, but how is that possible? Because isn't hemorrhoids about something that you can actually feel?
No, the thing is that these are anal vascular cushions. All of us, all human beings have these anal vascular cushions actually. So
Right.
the problem is that when it becomes pathological, that means it's causing symptoms. So that is when these hemorrhoids become a problem actually.
I see.
Okay.
Okay.
So, yeah.
Carry on,
Uh,
doctor.
yeah. So we can divide this hemorrhoidal disease uh, into internal and external hemorrhoids actually. Okay. So internal hemorrhoids are those swelling that is inside the anal area, in comparison to the external hemorrhoids, which is actually outside the anus.
Right.
Okay, so both of them present quite differently, in fact. Okay, so
Okay.
we also have a grading mechanism to how to grade internal hemorrhoids.
Okay. Can we take a look at the different types of hemorrhoids?
Yeah.
There you go. Grading of file. What's this about, doctor?
Okay, so whenever a patient come and sees us, we normally after taking a good history and after a full examination, we grade this hemorrhoidal disease into grade 1, 2, 3, and 4. So
Okay.
usually grade ones are this grading is only for internal hemorrhoids. So grade one is when the patient has no swelling around the perianal area, but mostly they present with bleeding. That means when they pass motion, they get some
Okay.
bleeding amplification. So
Right.
those are grade one. Now, grade 2, 3, and 4 are more severe because there is a prolapsing component. Prolapsing meaning which, when they pass motion, this internal hemorrhoids prolapses outside the anal area. And a lot of the times, the patient can actually feel these swellings. So in grade 2, this swelling, it prolapses during straining, but it spontaneously goes back into the anal rectal area again. In grade 3, sometimes the patient have to reduce it manually, have to push it back inside manually. Grade 4 is the worst, where it is irreducible. The internal hemorrhoids comes out and it is stuck outside, it cannot go back in.
Okay. Doctor, since we are actually discussing hemorrhoids, so I guess any type of question is not goes lah for now, because sometimes people tend to want to ask questions, but they are shy. So I'm just going to come right ahead and just ask the question: how big of a size are we talking about? Hemorrhoid grade 4.
Oh, grade 4 can be it can be as small as of a size of a what do you call it? Probably about 1 to 2 centimeter in size is possible to be. It can range from 1 to 2 centimeters to even up to 4 to 5 centimeters. Sometimes you can have like a a small cauliflower size, you know,
Oh.
actually. That means it's circumferential all over, I mean, it's around the anal area. So it depends on the longer the patient waits, the longer the symptoms become worse. So the size will just keep getting worse. So these are normally, and grade 4 are more complicated to treat them and requires more extensive investigation and extensive surgery and things like that. So it's best that we treat it at the early stage of 1, 2, and possibly 3. And the best is to going to grade 4.
Yeah. How painful is it?
Well, generally, grade 4 treatment require open surgical treatment. So it
Mm.
tends to be painful and the recovery is longer.
Okay. When you are at grade 4 of the files that you were mentioning earlier, when you are at grade 4, it comes with a lot of pain. And is this why people with hemorrhoids, when it is in this condition, they feel very uncomfortable, whereby they cannot sit, and it just gets in the way of their movements?
Right. No, some grade 4 has pain in symptom whenever the hemorrhoids have undergone thrombosis. But there are some people who don't have any pain. They just come with a mass, with a swelling outside the rectum that doesn't go back in, outside the anus that doesn't go back in. So
Yeah, yeah.
they may have pain, they may not. But the problem is that whenever there is grade 4 disease, majority of them still require surgery, and that surgery could be quite painful and will cause them to to be out of their work for a considerable amount of time. And the
Mm.
post-op
You mean,
very meticulous.
I see. Sorry, you mean the surgery is the worst part of it lah. Basically, because of the surgery, it becomes painful. That means before surgery, sometimes you don't feel anything
No, you can
except
have
for the
pain.
mass that's
As
there.
I said, whenever it is when the hemorrhoids gets thrombosed, you can have pain symptom. But as I said, not necessarily. Some have grade 4 and no pain, but some patients do have a lot of pain.
Okay.
Uh, Whatever said and done, for an open surgery at grade
Mm.
4 is generally it is quite painful actually in the postoperative period,
I see.
because
Okay.
other grades of 1, 2, and 3, there are a lot
Yeah,
of minimally invasive techniques available
I
that
see.
is actually very minimal and they can get back to work very fast.
Mm. Yeah.
Yeah,
Sounds like it's a very common disease, common
it is.
situation.
It's very common.
Mm. Yeah.
Um, so,
Maybe now we can talk about sorry, the common because we're talking about it and how common it can be, but what type of the criteria of a patient when we talk about hemorrhoids? Because usually, is there a certain traits that come with the patient who's suffering from hemorrhoids?
okay, so as I explained earlier, that by definition,
Mm.
hemorrhoids are vascular cushions in the anorectal area. So these are
Mm.
all, there are a lot of venous circulation there going on. So
Yeah.
anything that causes pressure to be increased in the abdomen
Okay.
can cause these venous plexuses to be dilated, hence it becomes symptomatic hemorrhoids. So what causes increased intra-abdominal pressure is those patients who for example, who do a lot of manual work. They lift a lot of
Um,
things. Even a lot of people who go to the gym, very active gym going people or what, because of heavy
Lifting
lifting.
weight.
Yeah, lifting weight, because it causes increased intra-abdominal pressure. So there's a chance that they may get hemorrhoidal disease. Uh,
Mm.
the other
Is there a
common,
difference between men and women, males and females, when we're talking about
well,
lifting weights? Is it more in males?
of course, lifting weights, I think men lift more weight than women. I
Would
mean,
you
when it
be
comes.
surprised now? Actually, a lot of women go to the gym and do strength
Oh yeah,
training.
yeah. I think
Understand?
yeah, but a lot of manual. I mean, if you talk about manual laborers,
Yeah, yeah,
men tend to do that work. So yeah, I think
yeah.
we see men in that group. But again, I think
Right, right.
overall there is a slightly more there's a slightly more chance of ladies getting this disease because of pregnancy. So
Yeah.
whenever they get pregnancy can predispose them to hemorrhoidal disease. We do see a number of pregnant ladies coming with even up to grade 4 disease.
Right.
So that's the thing. So because of increase in abdominal pressure.
Okay. So pregnancy and then weightlifting, yeah,
Yeah,
manual labor.
and
Any
lastly,
other
constipation.
constipation? I see.
Yes, whenever patients are constipated, they have difficulty evacuating their bowels, and
Yeah.
they have to strain a lot in the toilet. So that
Mhm.
causes increase in intra-abdominal pressure. So yeah, they tend to get hemorrhoids as well.
Right, right. What about age? Does age play a factor
Yes.
when it comes to
Uh,
hemorrhoids?
as we get older, as
Mm.
we get older, the chances are higher to get hemorrhoidal disease because of
Mm.
our supportive tissues become weaker as we get older. So yes, definitely, age is a factor as well.
I see. Mhm. Okay. Now let's talk about symptoms of hemorrhoids. Perhaps you can explain what are the symptoms.
Yeah. Well, in the very early stage, patients can get mild symptoms such as itchiness around the anal area, you know,
Yeah.
uh, some discomfort. So these are very early symptoms. But
Okay.
as it worsens, most common symptom is rectal bleeding, passing out fresh
Mm.
red blood when they after defecation, after they go to
Yeah.
toilet. Probably they see
Mm.
that there's some blood stains around the toilet bowl
Mm.
on the tissue paper or something. So that means a bleeding hemorrhoidal disease.
Yeah.
Other symptoms are, as I explained earlier, prolapsing mass. That
Yeah.
means after passing motion, you feel there's a swelling down there in the anal area.
Okay.
So yeah, and lastly is pain. So typically, external hemorrhoids can undergo
Mm.
thrombosis. So patient can come with a small painful swelling in the perianal area, and that swelling can be very exquisitely tender. So
Okay.
pain is a symptom as well. So it can be a mild symptom as in itchiness,
Mm.
discomfort,
Mm.
bleeding
Mm.
to
Mm.
collapsing mass, and
Mm. Okay. What are the kind of tests you carry out on a patient in order to diagnose them?
okay. Number one, a good history taking is very important. Okay.
Okay.
Number two is we have to examine the anal area.
Right.
These are clinic procedures we can do in the clinic itself.
Mm.
Sometimes a small device, we call it a proctoscope, just to
Okay.
see whether any hemorrhoids or not. Again, these are all clinic-based procedures.
Okay.
Those patients who have bleeding episodes, we also do a blood test just to see whether there is any reduction in the hemoglobin level or things like that. That will explain the severity, help to determine the severity of the bleed. Um, and the next step is very important because a lot of hemorrhoidal disease, the symptoms tend to overlap with other colorectal conditions like colorectal cancers, ulcerative colitis, ulcers in the colorectal area. So there is a group of patients that we will advise them to undergo an endoscopic procedure like a colonoscopy, so that we need to rule out other pathologies uh,
Yeah.
that could also cause rectal bleeding and pain in the perineal area and things like that. So once we have done all these tests as necessary, then we
Yeah.
will embark on how to treat these patients.
Yeah.
Okay. So we go on. So next is a bigger discussion altogether. Like, what are the treatment options available?
Okay.
Yeah. So I think when we talk about treatment options, it's always a discussion between what is the patient's, how severe are the symptoms, the
Mm.
patient, and of course, what we can offer to actually alleviate the patient symptoms actually. So it ranges from non-surgical treatment. We have uh, we have good medications that we can give to treat hemorrhoidal disease.
Right.
also give medication to reduce the constipation, because sometimes when the constipation improves, somehow the hemorrhoidal disease tend to improve as well. So, so these are non-surgical treatment. These are all medical management actually.
Right.
Yeah. What the other options are minor procedures as a rubber band ligation. Okay. So we have minor options as a rubber band ligation. These are again clinic-based procedures. And we also have other minimally invasive procedures such as laser hemorrhoidal, hemorrhoidopexy, basically laser surgery, stapler surgery, and lastly is open surgery, which is basically you excise out, you cut the hemorrhoidal tissue. So we have a wide variety of options to choose from. So basically, what we choose is depending on the patient's symptoms and the patient expectation.
I see. Okay. I gather that we're gonna go through one by one the treatments so that you can explain further.
Right.
Okay.
Right. So, well, non-surgical treatment or conservative treatment is extremely important. So again, most important is we treat the cause of the disease. So if
Okay.
let's say constipation is a cause, then we have to treat the
Right.
constipation. So we advocate high fiber diet, drink plenty of water, avoid sedentary lifestyle,
Yeah.
lose weight. That's very important. I mean, I think we know obesity is a pandemic
Yes.
nowadays. So lose weight. So again, a lot of my patients actually do improve a lot on conservative treatment itself.
Mm.
And of course, and again, non-surgical means lifestyle modification plus some medications that we give to actually reduce the size of the hemorrhoids and things like that. We also have medications for that.
Okay. Doctor, sorry, I'm looking at your slide now, and two of the suggestions say that you need to retrain the patient's toilet habit and proper anal hygiene. Can you give some examples of these tips?
Right. So retrain patients' toilet habit. Well, I think lately one of the issues is that we are always on our phone. A lot of people spend a lot of time on, I mean, we do spend a lot of time on our phone nowadays, browsing social media and things like that. So that habit goes to the toilet as well. So people actually
Mm.
spend time playing with their phone while they are in the toilet, when they're passing motion and things like that. So that actually prolongs the time that they spend in the toilet actually. So prolonged sitting, especially in the toilet,
Right.
that increases the pressure in the anorectal area actually. That's the thing. So I think the toilet habits must be managed well. So if possible, avoid taking your phone to the toilet altogether, playing with the phone while they are sitting in the toilet and passing motion. I think that's a very important thing.
Magazines. I think before there was the phone, newspapers and magazines were the culprits.
Yeah, but I think phones are more addictive than magazines.
Yeah, definitely. Definitely.
Right.
Okay,
So
after the non-surgical conservative treatment, let's take a look at what's next.
yeah. So again, these are non-surgical treatments. So we have topical creams to application in the anal area. We have suppositories that can be used. A short course of drugs. Um, Again, these drugs work. It increases the venous tone in the
Yeah,
anorectal area. And also, lastly, stool softeners. So, stool softeners work by um, improving patients' tolerability to avoid constipation, to prevent them from straining. So, yes. So, well, this again for me, I think even the stool softeners and all these habits, even for patients who go for surgery, I do advocate them after on. Just to prevent recurrence. I mean, so it is actually with or without surgery. These are standard practice that the patient should adhere to. High fiber diet, stool softeners.
right, right,
Okay, because ultimately you have to treat the cause of the disease,
correct.
not the disease itself.
Yeah, of course.
Okay? Yeah,
Prevention is better than
prevention is better
cure,
than
and
cure.
yeah, the
Yeah, and once you have cured it by any surgical method, of course you don't want
mm,
the symptom to come back. So again, you do advocate them to adhere to high fiber diets and good toilet habits and things like that.
I mean, once someone gets hemorrhoids, it can happen again even after surgery.
Yeah. Well, a lot of studies have shown that because these hemorrhoidal vascular cushions are basically, well, it is around our anorectal area actually. It is not one or
Okay.
two. There. So the thing is that with again when the patients go back to their old habits of again drinking water, less fiber, getting back again.
Right.
So
Right.
yes, you tend to get recurrences actually as time goes by.
I see.
So you have to, I mean, these managements are very important as well to prevent them from
Right.
coming back.
Okay. Okay. All right. I think we're done with the conservative treatment. Maybe we need to take a look at the. Okay. Yeah. I was going to ask this now. What exactly is rubber band ligation?
Oh yeah, rubber band ligation is one of the oldest procedures. These are generally for very small hemorrhoids, especially those who they tend to bleed, bleeding small hemorrhoids. So we tend to we do it using the proctoscope. So it's actually an office-based procedure. There is very minimum pain, very slight discomfort during the procedure. So what we put a rubber band that is tied around the base of the hemorrhoids actually. So after about 10 to 14 days, the hemorrhoidal tissue will just slough off and the area will heal and so basically render the patient asymptomatic after that. You know.
From your observation, most of the patients that you see for hemorrhoid, is this their chosen treatment?
Yeah, I
Pretty
mean,
straightforward,
again,
I
the
guess.
majority of the patients still come with early hemorrhoidal disease. So this office-based procedure is easily can be done, and outpatient-based procedure it gives a very good result as well. So yeah, it's a common procedure. It's done all over the country actually. I mean, all over the world is done.
It's outpatient treatment, you were saying?
It's outpatient treatment. Rubber band outpatient treatment. It's actually a clinic-based procedure.
Right. What about the I think you were talking about laser. Maybe the slide after this can show
Yeah,
this.
correct.
Okay. Laser treatment. Yeah. Is this
Yeah.
also an outpatient treatment?
No, laser is a more inpatient procedure. So
I
when we
see.
talk laser laser treatment for hemorrhoidal disease, it has become quite popular nowadays because of faster return to work.
Yes.
Especially for those with grade 2 disease, it gives a very good outcome. So it is my preference if let's say any patient comes with a grade 2 to grade 3 disease, if let's say they have any bleeding complaint as well, laser works very well. And I think the best part is that it's just an overnight stay, and the next day the patient can be discharged, and their return to work is actually quite fast.
Okay, sounds quite simple also lah.
Yeah.
Okay.
So what the laser does is that it kind of cuts off the blood supply to the hemorrhoidal tissue.
Mm.
It will cause, and of course, after that, we will laser the hemorrhoidal tissue. Basically, it is we burn off the hemorrhoidal tissue and it kind of shrinks as well. So it cuts off
This
the
is
blood,
done under this is done under general anesthesia.
spinal or general anesthesia. Yep.
I see.
This done under anesthesia.
Right.
Yeah. Compared with rubber banding, you don't need any anesthesia actually because that's why I say it's outpatient procedure.
Yeah. Yeah. Okay. So that's about laser treatment.
Yeah.
What?
There are also other treatment. Yeah. So again, so very fast recovery. So this is very popular.
Mm.
For me, the two minimally invasive options are laser and stapler hemorrhoidopexy. So stapler is good as well. So for me, I'll give patients both options if they require surgery, and then we discuss and what procedure will suit the patient best.
I see.
So
So
these
what we're
both
looking at right
procedures.
now, these
Pardon?
effects, these are the effects of. I mean, these are the benefits of both stapler surgery and also laser surgery.
Yes.
These fast
Both,
recovery,
both,
no
both have a
overall.
very fast recovery. Can be discharged the next day. Uh,
Mm-hmm.
you know, but again,
Okay.
patient preference is very important whenever
Yeah.
we choose procedure is done. So for me, these two procedures are actually very popular.
Yeah. How would you advise them, doctor, when it comes to treatments? What does it depend on?
Well, again, how severe the symptoms are.
Mm.
Okay, and generally, if the symptoms are very severe, sometimes they come with very heavy rectal bleeding and everything. All then
Right.
probably
Right.
yes, definitely surgical treatments comes much earlier as an option.
Mm.
Then,
Okay.
but again, in very mild disease, there's
Mm.
nothing, treating them conservatively first, and
Right.
always reassess and see how the symptoms improve.
I see.
Um, if the improvement is very minimal, then of course then you have the surgical options actually.
Yeah. Well, which is what we're going to see next, right? The surgical option.
Yes.
Next
So
slide.
yep.
Oh, okay. Maybe you can just explain a little bit
Yeah.
about the
The other surgical
surgical
option,
option.
like I would say,
Mm.
okay, when a patient presents early,
Mm.
as we have a lot of minimally invasive options to be used,
Yep.
like rubber bending, laser, stapler surgery. So these are all very minimally invasive, faster return to work,
Mm.
gives very good patient satisfaction. Okay. Problem is that when the patient comes very late in grade 4 disease, very severe, painful thrombosed hemorrhoids, well,
Mm.
our last option is open hemorrhoid surgery. Well, open
Right.
hemorrhoid surgery have withstood the test of time. It is one of the most oldest procedures.
Right.
Um, Again, it is a procedure done under anesthesia. Um, it's good to relieve the symptoms. The patient will feel
Mm.
much better after the surgery with regards to
Mm.
the prolapsing hemorrhoids, anything, but the procedure
Yeah.
itself is a bit painful.
So
Not a
how many
bit,
days would you have to stay
more
in
painful.
hospital for an open surgery like this?
I think it depends on patients. Some patients have, who can bear the pain. Probably we can even discharge them within 1 or 2 days. But I
Ah.
think there are patients who probably end up staying for even up to 3 or 4 days because of they need
Mm.
pain medications and things like that.
Yeah. Yeah. Right.
But
Okay, doctor.
uh,
Are there any? Sorry, I think we already discussed about the advice that you could possibly give in order to avoid someone from getting hemorrhoids. Because earlier you said about watch your diet, more high fiber foods, toilet habits. Do you have anything else to add to that?
um, maintain your weight.
Ah,
I yes. So I think to keep a healthy lifestyle and maintaining a
mm,
normal BMI, I think
yeah.
that is of utmost importance actually.
Okay. How serious can hemorrhoids get? Let's say if it is completely untreated.
Oh, I've had patients who come with torrential bleed because of neglected hemorrhoidal disease, and we end up going to operating them even in the middle of the night just to stop the bleeding. So
Yeah. Yeah.
So, in neglected cases, it can be quite bad actually. So that's why I think it's better for the patient to see their doctors and discuss with them about, what would be a best management option for their condition, and at the same time to make sure that there is nothing out there that is causing this bleeding. As I said,
Mm.
today colorectal cancer is I think it is number one disease for men in among
Mm-hmm.
the cancer prevalence, and number
Right.
two ladies actually after breast cancer. So again, we need to make sure that the rectal bleeding is not caused by um, colorectal tumor or something.
Yeah.
That's the thing. So some patients tend to think that whenever they have a rectal bleeding, they tend to think that yeah, it is just hemorrhoidal bleed. So maybe I can take some over-the-counter medications and just stay at home. Yeah, I think that is not quite right. I think they should come and see the doctor so that
Mm.
we should make the diagnosis whether it is hemorrhoidal disease or something else because
Right.
a lot of symptoms tend to overlap.
Yeah. So the lesson here actually is don't wait the minute. you have symptoms like what you mentioned earlier just now, Dr. Yuga, then just
Yeah.
go straight to the doctor and get some specialist
Right.
advice.
Because
Yeah.
hemorrhoidal disease is a benign disease. It's a benign
Uh,
disease, and yeah, we have a variety of options for treatment and everything on.
mm,
I think we shouldn't, uh, you know, wait until it becomes great for disease, or we think it's hemorrhoidal disease, but it's actually something else up there, something more sinister. So I think that is more important actually.
yeah. Um, since we're on that note, we actually have a question from Mr. Ivan Tan, and his question is, "Hi, Dr. Yuga. It's hemorrhoid related to colon cancer. And what would you
Hi.
say to this?"
That's a good question actually. Well, yeah, in a way, when a patient has a colorectal tumor or cancer symptom, so whenever there is a symptom of constipation due to the cancer itself, now that
Yeah.
can cause hemorrhoidal disease as well. So this is what we call the red herring, you know. So people may think that the symptom is hemorrhoidal disease, but there is something else up there, maybe in the
Right.
form of carcinoma. That's why whenever
Mm-hmm.
there's a symptom of altered bowel habit, that means like constipation, rectal bleeding, go and see a doctor. Just make sure it is not colorectal, uh, colorectal cancer or what that is up there.
Okay.
Okay.
We're
Yeah.
gonna
And
take a question now from. Oh, sorry, doctor. You're not done yet with the colon cancer question.
yeah. So that's the thing, because I said the symptoms may overlap between colorectal cancer and hemorrhoidal disease. So that's the thing. So yeah, any symptom like that, you have to get it checked.
Okay. I hope that answered your question, Mr. Ivan Tan. Okay, we've got another question here from Ms. Susanna Hani Hussein. The doctor is, sorry. The question is, if a person doesn't have any constipation problem but still have piles, maybe due to frequent bowel movements, what would be the best treatment?
Yep. Hi, Susanna. This is a very interesting question, actually. I do get a lot of patients who don't have any constipation, but still having piles problem, actually. Um,
Mm.
well, the thing is this. Number one, we need to assess how bad your symptoms are. Number
Yeah.
two is based on those symptoms, only we can decide whether what is the grade of the piles, as I said, grade 1 to grade 4. And then we have a option of treatment for you. Because not, as I said, not all piles need to be surgically treated. We have medications as well. So again, I
Right.
think to answer your question is that you need an assessment to decide
Mm.
what grade is your piles problem is. So
Mm.
then we can cater the treatment based on that and your symptoms, of course.
Okay. We've got another question here from Miss Chan Lee Hong. Hi, doctor. For second trimester pregnant lady with very bad hemorrhoids, would laser treatment be suitable? What do you have to say, doctor?
Yeah, hi, Ms. Chan. Well, this is a very interesting. This is another interesting question, actually. Now, as a rule of thumb, as much
Mm.
as possible, we try not to do any surgical procedures in
Mm.
when ladies are pregnant. Um, we try our best with conservative management first. However, um, again, if the symptoms are very mild, like grade 2 or grade 3 in pregnancy, I would still opt for best medical treatment first. I would try as much as possible to avoid surgical management in a pregnant lady, because the thing is that, of course, any surgery in the second trimester is quite safe. However,
Mm.
I mean, the dictum is that first thing is do no harm. Okay, so we try not to embark on a surgical treatment unless we really, really have to. So, if the patient is a candidate for a minimally invasive procedure in pregnancy, I would say that I think we optimize the medical condition as much as possible, because in pregnancy, a lot of them having constipation problems. So let's optimize their fiber, their the dietary fiber, give them some medication to ease their bowel habit, and I think almost most of my patients, the symptoms improved. they did not require surgical management actually in pregnancy. And the best part is that after they deliver, the hemorrhoids tend to regress and it tend to improve tremendously. So again, as a rule of thumb, we try to go on a conservative treatment as much as possible. But at this,
Right.
so I think that depends on the assessment, and when we assess the patient, then we decide from there.
Yeah. So it still boils down to getting a healthy diet, healthy eating, yeah?
Correct. Because in pregnancy, as you know, constipation in pregnancy is very common, increase in
Mm.
abdominal. So I don't think I think if we improve these things, the hemorrhoidal disease, it gets better.
Yeah.
So
Okay.
basically we are treating the cause of the condition actually.
Right. Yeah. Okay, I've got a question here about colonoscopy. Do you have to go, does the patient have to go through a colonoscopy to confirm hemorrhoidal disease?
Oh, okay. Well, we can confirm hemorrhoidal disease just by clinic-based proctoscopic examination. Proctoscopy is a very small device. After lubrication, we put in the anus just to check for hemorrhoids. So actually, that's good enough to diagnose. Plus, with your symptoms and things like that. Of course, when you do colonoscopy also can further confirm the presence of hemorrhoidal disease. And of course, if the symptoms are there, yeah, insurance companies do cover, medical cards do cover for a colonoscopy in a symptomatic patient. That's not a problem actually.
Yeah. Okay.
That answers the
All right.
question.
There's a question here in bahasa. Dr. Yuga, ada apa-apa rawatan yang sesuai untuk buah hasil tahap 3 yang kena tolak masuk setiap kali buang air besar?
Oh, okay,
Yeah, you're
Mr. Chang.
welcome to answer either English or Malay.
Ya. So, Mr. Chang, okay, terima kasih atas soalan ni, untuk soalan ni. So, jikalau pada fase yang tahap 3, again, rawatan dia bergantung pada how severe your symptoms are lah. Okay, so kalau Cik Chong kena tolak, kalau buasi ni perlu ditolak masuk ke dalam, so the option of surgery is always there. Okay, so there is a role for surgical treatment. But again, we can always start the patient on a medical treatment first and see how the patient improves and then give them the surgical option. So kita boleh cuba kaedah-kaedah tanpa pembedahan dulu, dan option pembedahan tu masih ada lah kalau simptom dia masih tak banyak perubahan.
Yeah.
Okay.
Doctor, but if you push it inside and it doesn't come out anymore, does that mean that you don't have to see a doctor, that it's okay?
No, that's the thing. I think it all depends on the symptoms of the patient. The patients, if the symptoms are relieved,
Right.
I think patient satisfaction is very important
Yeah.
with regards to the disease condition, at what stage they are, and at the same time of what kind of treatment that the patient can accept. I think that is very important actually. So there are some patients, after we diagnose them with even stage 3 hemorrhoids that they have to push back in, if
Yeah.
the patient can tolerate that, if they are not troubled by it, they are used to it. And of course, we do explain to them that, don't let it go to stage 4, which is even worse.
Yes.
So as a doctor, my job is to give the patients advice and give them the options of treatment. We don't impose surgery on them,
Yeah. Yeah. Of
So
course.
my job is to advise them and give them the best practice that is, based on the latest evidence, latest research, that what is the best procedure or best management for them, and
Yeah.
they can choose actually.
Just explain the options available. Otherwise, whatever makes them comfortable, right?
Correct.
Okay. All right. We've got a question here from Ms. Bella Yi. Hi, doctor. Will you recommend laser treatment for senior citizens with grade 3 hemorrhoids?
Yeah. Hi, Bella Yi. Okay, thanks for your question. Okay, well, I do laser treatment even up to grade 3. Um, Evidence have shown that it does work in grade 3 hemorrhoids pretty well. So yes, again, definitely, if the patient needs a laser procedure, we can always recommend it to them. It can be done.
Is age a factor, doctor? Sorry, don't mean to interrupt you, but
No.
it's relating to this question as well. When
No.
you advise the kind of treatment for the patient, is age a factor?
No, age is not a factor. But of course, when we are talking about invasive procedures, under anesthesia. So of course, when they are a bit on the, when they are on the older side, so we need to make sure they are fit for anesthesia and things like that. Of course, we will do our own preoperative assessment to make sure they are fit for surgery before we embark on that. So for grade 3, the choices are between stapler surgery versus laser. So again, I give them the options, pros and cons of both conditions, and they can choose. Of course, there are patients who even request for even open surgery can be done on a grade 3. Of course, it is.
Mm.
I told you, um,
Yeah.
the recovery takes a much longer time. You really need to
Right,
take care in the post-operative period. So again, even
right.
grade 3 can be done actually. So we have multiple procedures to cater
Mm.
for all this at different stages of hemorrhoidal disease. So that's the thing.
Yeah,
What's the best for the patient is a basically a two-way discussion between the doctor and the patient actually.
yeah. Okay, doctor, there's also another question here by Miss Lee Lin. Hi, doc. How to manage after laser hemorrhoid? It's a three-in-one question. How do you manage after laser hemorrhoid treatments? How many days of hospitalization, and when can the patient go back to work?
Okay. Generally, um, generally, what we do is that um, it is basically a overnight. Patient tend to spend at least 2 to 3 days in the hospital. Well, my patients after a full workup, if I admit them in the morning, I can always do the procedure later in the afternoon and discharge them the next day. Actually, so it's basically an overnight stay. So these are patients who actually are fit without any much medical problems and things like that. So basically, a 2 day stay. They return to work uh, pretty fast actually. So usually I'll give them time off work for at least about a week, so that they can take care of themselves, probably rest, recuperate at home, and usually they're back to work after 1 week, 1 week after the procedure.
What about after hemorrhoid surgery? How long can the person go back to work?
You mean what type of hemorrhoid surgery? You mean the open? You mean to cut it out? Is it?
Open, sorry. Yeah, hemorrhoid surgery, open surgery. How long
Yeah.
can
Okay. When
the
you talk about if you return to work, it's a very interesting question. For those who
Mm,
undergo rubber banding, basically the next day they can be back at work.
yeah.
Okay, but those who are more severe disease for laser and stapler hemorrhoid surgery, so usually I tend to give them about a week, and then they're back at work. For open surgery, which we have to cut it out for this great force
Yeah.
and everything,
Mm,
yes, I think sometimes even up to 2 to 3 weeks I tend to give, because there's the patient care is more meticulous. When they go
right.
back, and they have to keep the area clean. Of course, it'll be
Mm,
uncomfortable for them to go back. Early return to work is definitely uncomfortable for them, and we also have to
yeah.
prevent infections. There are a lot of things I have to consider. So I give them longer time off work for open surgery.
And they have to come back for follow-up appointment also after that.
Yeah, I mean, definitely, all of them do have to come for follow up. But
Right.
for ones, I do follow them up
Mm,
quite often, just to make sure that there is no any bleeding or infection or what in the post-operative period.
okay. Okay, we've got time for one last question here. This is from Miss to Catherine. Doctor, can I ask what would happen if we delay treating the hemorrhoid, like issues, no pain, no bleeding?
Okay. Well, okay. So first of all, with regards to treating the hemorrhoids, that means if there's no pain, no bleed, so I assume the symptoms are prolapsing, is it? That means there is a swelling outside or what? So because as I said, the one of the other symptoms is prolapsing mass. That means there's a swelling outside the area.
Mm,
So if the swelling is very mild and the patient is not keen for any type of surgical procedure, we,
mm,
we basics. As long as the patients are strict enough
yeah.
to avoid constipation, drink a lot of water, and again, go for a proper follow up with your doctor. So I think, yeah, of course, you can still keep it closely under observation. There's definitely an option of that. So, but again, yeah, I think high fiber food, avoid constipation is, I cannot, I have to overemphasize on this actually, because
Yeah.
these are very, very important things.
Back to basics.
Yeah, back to basics.
Okay, doctor, I think that's all the time that we have for today. So thank you very much, ladies and gentlemen, for joining us on Dr. Go Live.
Yep.
Oops.
So,
Okay, there you go. There's a QR code here. If you'd like to make an appointment with Dr. K. Yugasaravanan at Columbia Asia Hospital, Seremban, this is the QR code. Yep. Apart from that, again, thank you. Thanks, doctor, for your time. Yeah,
thank you.
hopefully we can have you again on the show on another topic.
Sure. Yeah, hopefully one day. But the thing is that thank you very much for all the audience, for your patience, and thank you for all the questions, actually. Fantastic questions. And thank you, Sakina, for the opportunity.
No problem. My pleasure. Thanks,
Okay.
everyone. Bye. Take
Yeah.
care.
Good evening. Bye.